Imagine you're a qualified nurse, ready to start a new life in the UK, ready to make a difference, and you've aced your interviews,
Mm.
been selected. You're just waiting for that visa, and
Mm.
then nothing. Silence. That's what so many overseas nurses are facing right now. Even with the NHS, the UK's National Health Service. I mean, they're facing a massive staffing crisis.
Yeah, it's a real puzzle, isn't it? I mean, on one hand, you have this desperate need for nurses, but the numbers actually coming in are just going down and down. The article we're looking at today points to this boom and bust cycle as a big part of the problem.
Okay, so let's unpack that a little bit. So boom and bust. The article mentioned this surge in overseas nurses being recruited between 2022 and 2024.
Hmm.
Was that just because of the pandemic?
Yeah, exactly. The COVID-19 pandemic, right, put so much pressure on the NHS. They needed nurses like yesterday. And international recruitment was a huge part of how they were coping. But as the pandemic started to wind down, the UK government kind of changed course. They brought in stricter immigration policies, trying to reduce overall migration. And those policies, well, they really had an impact on how many healthcare workers they could recruit.
So even though the need for nurses is still there, it's just become way harder for them to actually get into the UK.
Exactly. Think of it this way. It's like the door was wide open there for a little while, and now it's almost slammed shut. The article points out three main changes in policy. First, there's this thing about the higher minimum salary thresholds.
Oh, right. I read about that.
Yeah. So if you're applying for a skilled worker visa, the kind of specifically for professionals like nurses coming from overseas, for a lot of nurses, especially those just starting out, these new salary requirements, they're really tough. A real
Yeah.
barrier.
So even if they're fully qualified and the NHS desperately needs them, if they don't hit that higher salary, they're just out of luck.
Basically, yeah.
Yeah.
Which is, I mean, it's crazy. And then on top of that, you've got the second big change restrictions on visas for families.
Oh, right.
A
Right?
lot of nurses, they want to build a new life in the UK, right? It's not just for them, but for their families too. But these new restrictions make it so hard to bring your loved ones with you. So the UK just becomes a less attractive option.
That makes sense.
Ah,
I mean, moving to a whole new country is a huge deal, and even more so if you can't bring your family along.
absolutely. And then there's the third policy change, and it's maybe the most telling of the three. The article talks about this huge drop in the number of health and care worker visas that are being issued.
Hmm.
Yeah. It says there was a 26% annual decrease, and get this, an 81% drop just in the second quarter of 2024 alone.
Wow, 81%. That's massive.
Yeah, it really shows you how much of the policy has shifted.
It sounds like these stricter immigration rules, combined with the fact that there's still this massive need for nurses, is creating a really tricky situation.
Yeah, you've got it. On the one hand, nurses want to work in the UK and the NHS needs them desperately. But these immigration barriers, they're just a huge obstacle.
And then if you add in the financial problems the NHS is dealing with, it gets even more complicated, right?
Yeah, absolutely. The article talks about how NHS trusts are really struggling with rising costs everywhere. They're having to rely more and more on temporary nurses, the ones they call bank nurses, or those working through the NHS Professionals Agency. But these temporary staff cost way more than permanent employees.
So it's a bit of a catch-22, isn't it? They can't afford to hire permanent international nurses because their budgets are so tight.
Yeah.
But then they have to rely on these expensive temps, which just makes the budget problems even worse.
It's a vicious cycle, and it makes you wonder if this whole idea of saving money in the short term is actually just making the long-term problem even bigger.
It really does sound like a complicated situation, no easy answers. But let's maybe shift gears a little bit and talk about the nurses who do manage to get over all these hurdles and make it to the UK. The article makes their experience sound pretty tough.
Yeah, it does. Imagine finally arriving in the UK, excited to start your new job, but then, bam, you're immediately hit with these huge workloads because the ward is so short-staffed. That kind of constant pressure can lead to burnout really quickly.
And it's not even just the crazy workload, is it? The article also talks about how hard it is to be away from family, adjusting to a new culture,
Yeah.
and then the cost of living in the UK is just going up and up.
Yeah, you're right. For a lot of these nurses, they decide to move to the UK because they want a better life for themselves and their families. But then if they can't see their loved ones for long stretches because of visa issues or just not being able to afford it well, that makes it incredibly tough.
Yeah, it's like this double-edged sword.
Yeah.
They come looking for opportunity, but then the reality once they get there is way harder than they expected.
And that kind of leads to another thing the article brings up, the fact that other countries are starting to look more appealing. So while the UK is making it harder for overseas nurses to come in, places like Canada, Australia, and New Zealand, they're actively trying to recruit them. You know, these countries are often seen as offering a much smoother immigration process, more support for families, and just a better quality of life overall.
Oh, interesting. So it's not just that fewer nurses are coming to the UK, they're also maybe thinking about leaving for these other countries.
Yeah, unfortunately, that's the situation. And it has big implications for the NHS, right? Fewer nurses means the ones who are already there are even more stretched. Thin leads to burnout, and then that impacts the quality of care patients get. Wait times could get longer, and the whole system could just become too strained to function properly.
Man, it's all
Yeah.
sounded pretty bleak. But wait, in the outline for this deep dive, there's a section called Glimmer of Hope. Are there any signs that things might actually improve? Are there any efforts being made to fix all of this?
Yeah, for sure. The situation is definitely serious. But there are some good things happening too. One thing is just the sheer scale of the problem. I mean, the NHS staffing crisis is enormous. We're talking tens of thousands of unfilled jobs. And that level of need, well, it's a huge push for people to find solutions.
So you're saying the problem's gotten so bad that it's kind of forcing people to come up with answers.
Exactly. And if you look back historically, whenever the NHS has had these kinds of really bad shortages, they've always ramped up their recruitment efforts. There's a precedent for taking action when things hit a breaking point.
That's good to hear. The article also mentioned advocacy groups like the Royal College of Nursing. What are they doing about all this?
They're doing a lot of important work. They're really pushing for changes in policy that would make the UK a better place for overseas nurses to work. Things like making visas cheaper, easing the restrictions on visas for families, and also making it easier for international nurses to get registered in the UK, smoothing out that process.
So they're basically trying to make the whole environment more welcoming and supportive for these nurses. But are the people in charge actually listening? Are they considering these changes?
It seems like things are starting to move. I mean, no major changes have been announced or anything, but the government is starting to realize that something has to be done. The staffing crisis isn't going away, and they're understanding that just restricting immigration isn't going to solve it.
Well, that's good, I guess. It sounds like they're realizing that there needs to be some kind of balance, right?
Yeah.
Between managing immigration and making sure the NHS actually has enough people to do the job.
Right, exactly. And it's not just about policies. There's also this growing focus on making things better for overseas nurses once they actually arrive in the UK. Like better support system.
Oh, that's interesting. What kind of support are we talking about here?
Well, think about it. If you were a nurse moving to a whole new country, what would make you feel welcome and supported? So the NHS is starting these mentorship programs where experienced nurses can kind of show the new arrivals the ropes, help them adjust to life in the UK, and figure out the system. They're also working on streamlining that whole onboarding process, making it easier and less overwhelming.
Okay, so it's not just about getting them here. It's about making sure they feel good about being there once they arrive, that they feel valued.
Exactly. And some NHS trusts are doing even more, like creating initiatives to help overseas nurses become part of the community, connecting them with social groups, cultural things, even language classes.
It sounds like a more well-rounded approach, I guess, recognizing that it's not just about filling a job, it's about welcoming someone into a whole new life.
Yeah, that's a great way to put it. And then there's the whole money side of things. The article talks about how the NHS is looking at different ways to fund things. New funding models. That could mean more money specifically for recruiting and keeping overseas nurses.
Can you give me an example? Like, what would that look like in practice?
One idea that's being talked about is this International Recruitment and Retention Fund. Imagine there's this dedicated pot of money specifically for attracting and supporting overseas nurses. So it wouldn't be part of the regular NHS budget, they'd have more flexibility, and it wouldn't be subject to all the same pressures as other areas of healthcare spending.
Huh, that's pretty clever. It kind of shows that they understand how important international nurses are and that they're willing to prioritize recruiting and keeping them.
Right, it's not just a quick fix, it's about building a healthcare workforce that can actually last into the future.
This is all really encouraging. But in the end, it all comes down to whether the UK government is actually serious about fixing this whole thing right.
Definitely. The future of overseas nurses working in the UK depends on a lot of things. Whether the politicians are willing to make changes, what the economic situation is like, and whether they're truly committed to making things work for international healthcare professionals.
It's a lot to balance. What do you think is the most important factor in all of this? Like, what's going to make or break the UK's ability to turn this whole situation around?
For me, it's about seeing the value that these overseas nurses bring to the NHS. It's about recognizing that they're not just a temporary solution or a way to save money. They're skilled professionals who are absolutely essential to the health and well-being of the entire country. And they need to be treated that way.
That's a really important point, and it kind of leads us to a big question for you, the listener. Thinking about all the challenges we've talked about and the potential solutions that are out there, do you think the UK can figure out the right approach? Can they find that balance and create a healthcare workforce that's going to be sustainable for the long haul? It really makes you think, doesn't it? I mean, how the UK handles this whole thing with overseas nurses, it's not just about them. It could actually have an impact on healthcare around the world.
Oh, for sure. It's a complicated issue, no doubt. What I find interesting is that this situation in the UK, it's kind of a microcosm of this global trend, healthcare workers moving from one country to another. It makes you think about how we could create a system that works for everyone, the countries that need healthcare workers and the countries those workers are coming from.
You've mentioned this idea of ethical recruitment partnerships before. Could you explain a little more about what that would look like?
Okay, so imagine this. The UK teams up with a country like India, which has a ton of trained nurses. Instead of just recruiting them away, they work together. Joint training programs, sharing knowledge, maybe even working on healthcare projects together. That way, the UK gets the nurses they need, and at the same time, they're helping to build up the healthcare system in the partner country.
So everybody wins. It solves the staffing problem in the UK, and it makes sure that recruiting nurses doesn't end up hurting healthcare in other countries.
Exactly. It's about moving away from this kind of transactional way of thinking about recruitment and toward a more collaborative approach,
Yeah.
one that recognizes that we're all connected when it comes to global healthcare.
It's a really interesting idea. It feels a lot more sustainable and ethical in the long run.
Yeah, it's definitely a step in the right direction. Of course, to actually make it work would take a lot of planning and commitment from everyone involved. But it's a good goal to have.
Well, as we wrap up our deep dive today, we're left with a picture of both the challenges and the opportunities around this whole issue of overseas nurses working in the UK.
We've looked at all these different factors that are causing the decline in nurses coming to the UK from overseas, the stricter immigration policies, the financial problems, the tough realities of actually working as a nurse there, and then the fact that other countries are starting to look more effective.
But we've also talked about some potential solutions. Changes to policy, the work that advocacy groups are doing, the focus on creating better support systems, and then some interesting ideas around how to fund things differently.
And maybe most importantly, we've talked about how we need to see overseas nurses as valued members of the healthcare team, not just a temporary fix. They're essential to making sure the NHS is healthy and can keep running, and they deserve to be recognized for that.
It's a good reminder that the decisions that are made by people in power, by healthcare leaders, even by individuals, they all have a big impact. And not just on the future of healthcare in the UK, but potentially on how healthcare works around the world. And with that, we'll leave you, the listener, with one final thought to think about. As the UK tries to figure out this complex situation, what role should international collaboration and ethical recruitment play in creating a healthcare workforce that can actually last into the future?